All right, if I could get everybody to grab a seat. All right. Thank you all. Thank you all for coming back quickly. All right. Thank you all for coming back quickly. This is a part where we're going to talk about policy, and we are extremely fortunate to have some very, very, very senior policymakers. The downside of having very senior policymakers is they have important jobs, and sometimes those jobs call. And so we are going to move quickly. I was going to do a whole thing about why policy matters. I think everybody understands why policy matters. Policy matters at the state level, but this is a really important, deeply bipartisan issue where federal leadership is so critical. And so I'm going to start off by just introducing our first speaker, Senator Blackburn. Marsha Blackburn really doesn't need much of an introduction. Senior senator from Tennessee, has held a variety of leadership roles, but has really been a fierce advocate for children and children's mental health, and the role of tech companies. So before I go on any further, let me just introduce Senator Marsha Blackburn. Senator, thank you so much for being here.
I am delighted to be here with you all for a few minutes, and delighted to see my fellow Judiciary Committee member, Sheldon Whitehouse, also here in the room with you. And I know you have talked this morning about kids and the virtual space and looking at some of these issues that are addictive issues and the damages that come to kids from the endless scrolling and the algorithms. And I hope that as you look at this, and as you say, as we talk about policy, you say, what can we do about this? Now, one thing I do want to highlight is it was in 1998, the last time there was a major law that was passed that dealt with children and the internet. 1998. So think about this. And that's probably before many of you were even born. And so this is how long it's been. Now, think about in your lifetime the changes that have happened and how the internet is used, and social media platforms that have come about, and how these have matured and how people use them. So the question you need to ask is, do you really think a law passed in 1998 is sufficient to protect in the virtual space? And you probably would say, absolutely not, you know. Because when you look at new technologies and new applications that come about, there is generally about an 18-month lifespan on these things. And then you've got updates, and you've got changes, and you've got new uses, and they are applying differently. Now, for years, my colleagues and I at Senate Judiciary and also at Senate Commerce have been looking at governance of the internet. And as we started looking at these issues, and the Senate had a Judiciary Technology Task Force that I led in 2019 and 2020. And we started looking at how the internet was shaped, the utilizations, the governance, looking at the backbone, looking at the applications and the software that was used. And then Senator Blumenthal and I started to take an even deeper dive on the effects of children. And at our first hearing, where we looked at children and the internet, it was like we opened a wound that was there for parents, for children, for teachers, for pediatricians, for principals. They all stepped forward and they said, "Let me tell you my story." And they wanted us to hear what had happened to their child because of something with TikTok or Snapchat or Instagram. And I want to just run through some of these stories with you today, because these heartbreaking stories is what has really spurred us. Jenny DeSario, whose 16-year-old son, Mason, was inundated with hundreds of video posts on TikTok that glorified suicide. Now, Mason was a standout football and track athlete. He went to school. He grew up in Northwest Arkansas, and he was flooded with these glorified suicide concepts after he had looked for quotes, inspirational quotes and affirmative affirmations on TikTok. And what did he get? Glorifying suicide. We also heard from Grace McComas's family. She died by suicide after the young man who drugged her and sexually assaulted her took to social media and defamed her and made her feel isolated, afraid, worthless. When the abuse started, Grace's parents informed the school, the police, and the state's attorney. Yet there was nothing they could do to get Grace's tormentor banned from the digital platforms, and the abuse to her was 24/7. Kathy Borum, a Middle Tennessee mom whose 17-year-old son, Von Thomas, passed away from fentanyl poisoning after taking a Xanax purchased off Snapchat. He was trying to cope with the stress of teenage life. And what Kathy told me is heartbreaking, because this is where so many parents have landed, that victims of social media harms, one mistake should not be a death sentence for these children. And when it comes to meeting these drug dealers and these sexual predators, many times that one mistake ends up being a death sentence. And the thing is, these type tragedies are happening all across the country every single day. And Congress did step up, and in the Senate, Senator Blumenthal and I have worked for over 3 years on the Kids Online Safety Act. There are 72 members of the Senate that are co-sponsors of this bill, and it came out of the Senate with a 91-3 vote. It is hard to get a 91-3 vote on anything, and we were thrilled with that positioning. And it is over in the House. It has cleared the subcommittee and the Energy and Commerce Committee, and we are waiting for it to get a floor vote. Now, here's what the Kids Online Safety Act would do. It would create new tools for parents to identify harmful behavior and report that behavior directly to the social media platforms, and require the social media platform to respond. Because as in the McComas situation, they reported it, they went to everybody, and they couldn't get the platform to do anything. It would provide controls to families, to parents and kids, so that they could opt out of these algorithmic recommendations. Kids get going down, they Google or they search for something once, and then they're flooded with it. It would require mandatory audits to ensure that the platforms are mitigating the harms to children. There again, they've got to respond and admit their awareness of this. And COSA would create a duty of care for online platforms to prevent specific dangers to minors, including the promotion of suicide, eating disorders, substance abuse, and sexual exploitation. Specifically, COSA will hold big tech platforms accountable and put the power back in the hands of kids and parents so that they don't have to see things they don't want to see. And Senator Blumenthal and I are working to get this finished, to get it finished up in the House so that we can get it to the President's desk and he can sign this. Now, unfortunately, there is misinformation that is out there about what COSA would do. We had an organization this morning that sent a letter out with a string of misinformation. And so it's up to us to refute it. There are some who say, well, COSA would be a censorship bill. This is false. COSA doesn't do anything to restrict content. It is a product safety bill. Now, there are safety standards on just about every product that you buy. It could be the chair you're sitting in, the soft drink beverage can. It could be the glassware that you have. The only place you do not have product safety standards is in the virtual space. This is a safety by design feature. We've also heard from people that say COSA increases the rule-making authority of the Federal Trade Commission. This is false. COSA gives the FTC clear direction, and that direction comes from Congress, from the wording in the bill, from that statute. It gives it clear direction on how this would apply to existing enforcement authorities to protect children in the virtual space. There's no additional authority that is there. And you know, we have laws in place in the real world that protect children. You can't sell tobacco, firearms, alcohol to a minor. You can't take them to a strip club. But in the virtual space, they are exposed to all of this all day long, every day of the year. And we have heard from people who claim that COSA will require you to upload all sorts of ID to use social media, and that is false. There is no age verification in the Kids Online Safety Act. And I think it is very important that we dispel these falsehoods that are out there about the legislation. Because as I said at the beginning, it has been since 1998 that Congress took an action to protect minors in the virtual space. A lot has changed. So we are very hopeful. We are looking forward to get it passed, and we are grateful, so grateful, for your awareness and your interest. Thank you so much for letting me pop in. Appreciate it.
Senator, thank you so much for both taking time out of a crazy day, but also really your leadership in this area, because it has been the senator's leadership, Senator Blumenthal, others who've championed COSA, that I think this represents an opportunity to really make progress on a set of issues that we've been talking about today. Somebody else who's been championing youth mental health for a long time has championed a whole host of issues in healthcare and health delivery. I first got to know Senator Whitehouse before I came to Brown, when I was out there working on electronic health records, and he was probably our most fierce advocate of getting electronic health records and interoperability out into the healthcare system. A former attorney general from the great ocean state of Rhode Island, Senator Sheldon Whitehouse.
Thank you, Doctor. Thank you, President Paxson. Thank you, longtime friend and generous Rhode Islander Alan Hassenfeld. It is wonderful to be with all of you. Senator Blackburn and Senator Blumenthal have done very good work on this, so I'm delighted to have the chance to speak from the podium that she did. And I also want to recognize Congresswoman Schreier, who is here and actually knows something about this area as a pediatrician. So since I don't know much about this area, I want to touch on two things that I think could be useful information. The first is the arrival in Rhode Island of the CCBHC, the Community Centered Behavioral Health Centers. They're a little bit like the community health centers that are already up, but they're separate. Some of them are binding themselves together. In the world of behavioral health, what we have now in Rhode Island is an array of separate strands of heroism. Whether it's the police officers learning to redo their work with peer recovery specialists riding along with them, or the fire stations opening up fast access to treatment centers through their doors, or whether it's the traditional heroes of peer support and addiction recovery and treatment. There's a very broad area. I would also add, since Brown is now in charge of a number of emergency departments, ED doctors have a big stake in all of this as well, as of course do behavioral health professionals. And what I have seen, again, is heroic work in each one of those strands, but heroic work by heroes who are so stressed out and have so much demand for their effort that there really isn't any room to say to them, hey, why don't we pause for a while and let's all get together and figure out some kind of sensible, comprehensive system. So this isn't done by anecdotal individual case and heroism, but we actually have a Rhode Island-wide structure for responding particularly to behavioral health and addiction-related emergencies. I believe that the new funding and the new structure of the CCBHCs can be that last stone in the arch that allows all the others to stand and not just fall in when asked, because I think it's one of those areas where when you invest up front and you develop a better, fairer, more effective system, it actually will make it easier in the long run, but you have to get over the hump of building that structure and again, refining it over time. So please look at these CCBHCs not just as a new entrant into the existing melee, but also as potentially the last ingredient that allows us to think about this in a comprehensive way. And I think that Brown has a very important role with all of its thought power to help bring that to bear. And I think that I've spoken to senior state government officials about it, and I think there's a lot of willingness and openness to proceed. So let's look at the CCBHCs not just as an addition to the existing situation, but as a potential game changer in that situation by bringing folks together. So that's point one. Point two is, and let me first say before I get into point two much further, I immensely value the work that mental health providers do. It is essential work, it is under-resourced work, we need more of it. Don't let anything I say take away from that point. But I think closely related to the youth mental health crisis that we are experiencing nationally is an adult irresponsibility crisis that we are experiencing. It is not unreasonable or a sign of a mental health deficit to be an extremely anxious and frustrated young person these days. You go to school and you're faced with a childhood nightmare scenario. An armed person in your school, where do I hide? That is the stuff, literally, of nightmares. And we put our kids through active shooter drills because adults are too irresponsible to figure out how to make those schools safe for them. That's not a good situation. They move to their science class and they learn about the inevitable havoc of climate change coming at them and what their lives are going to look like in the out decades. And then they look at the adults and what are we doing on it? Completely failing. This year, after everything that's gone on, we just put more carbon dioxide and methane into the atmosphere than we ever have before. For all the talk and for all the nonsense and for all the greenwashing, it is a massive adult failure. And it's obvious to people, and it's obvious to young people. They're not stupid. I would add what we started with in the earlier conversation, social media. Social media is a black hole of abuse and nightmares for many children. It is causing many children to actually commit suicide and have all sorts of intermediate mental health issues. And what have we managed to do about it? Nothing. Senator Blackburn and Senator Blumenthal's bill would be a good thing, but the bottom line would be to repeal Section 230, which is the section from the earliest days of the internet, when it was actually happening in garages where they were insulated from liability. These massive companies that create these massive harms don't face the same liability as the newspaper company, or the pharmaceutical company, or the auto company. They're in a unique, peculiar, and distinctly un-American zone where they operate outside of rule of law, just within their own algorithms and strategies. That has to stop, and if it does, it will clean up very rapidly the toxic social media environment that we have created, adults have created for kids. And then I guess the last point would be, when I grew up, there was a thing called deportment. Like, you gotta behave yourself. And adults were supposed to model good behavior for children. I don't see a lot of adult modeling of good behavior right now. We have an incoming president of the United States who models really unpleasant, violent, abusive behavior that you'd punish a toddler for. So where is the structure? Where is the sense of, I can trust adults when I can't trust them to keep my school safe, I can't trust them to keep my future safe, I can't trust them to keep my devices safe, and the way they behave is embarrassing. It's below the standards that are set for me by my parents. In that environment, I think it's really important to understand that kids need mental health support, but the notion that there's something wrong with this generation because they need all those mental health supports, that is an idea that we should eradicate. And we should look up. We should look up the chain to the adult irresponsibility crisis that is causing so many of these very legitimate anxieties and frustrations. So I leave you with those two thoughts. I wish you well. Thank you, Brown University. And thank you, Dr. Fowler.
Senator Whitehouse, never a man to mince his words. And Senator, thank you for all of your leadership across so many issues, but particularly around health and well-being of our citizens. So really grateful for that. In the tradition of keeping introductions short, I'm going to keep our next introduction also very short. Congresswoman Schreier from the great state of Washington, the only pediatrician in Congress, has really taken on some of these issues head on, and we are very grateful for her leadership and her time here today. So thank you and congratulations on your recent re-election.
Well, first of all, thank you to the Hessenfeld Child Health Innovation Institute at Brown for having me here today. I don't usually say this in these rooms, but I would like to associate myself with the gentleman's remarks. And I'm deeply worried about a lot of social impacts on our children. And today I'm going to focus on social media. But there is a whole milieu that is affecting our children in the way they're growing up in the world and the anonymity of the web. And I think we all need to be not only attentive, but to take our own steps as we wait for legislation to make its way through, because we're not powerless in this. So as a pediatrician, I have deep concerns. I mean, I have seen in my own clinic a sudden steep rise in anxiety and depression and eating disorders in younger and younger kids since about 2007. And we've seen this trend that continues to escalate, and it has been coinciding with social media, but so many were waiting for proof. And the thing is, you're not going to get a double-blind controlled study on this because of the numbers of hours kids spend, different vulnerabilities, what they're on social media-wise, what they're looking for. But we all know, and now there is proof, that there are so many threats. I'm just going to start with the basic. Just screen time. Before we even get to social media, let's talk about the screen time in toddlers and not learning to talk early enough and not developing eye contact. My teenager, who I love dearly, didn't get a cell phone until he was almost 15. He's still not allowed on social media, and I do check his phone to make sure that the apps are not there. I know that things still filter in from other people, and I know that a lot happens on text messages. So I'm just going to touch on that because, I mean, even just the habit of texting back and forth has impaired our kids' ability to make eye contact. He interned on a campaign this summer because I thought, I mean, he wanted to do it. I thought it would be so important to have to pick up a phone. They never pick up a phone, right? We just text now. To have to pick up a phone, dial somebody he didn't know, start a friendly conversation, and understand that you sound different when you are smiling and talking on the phone. And I think it is such an important lesson to learn, first for the telephone, but also we see it in high schools where kids are breaking up with kids on texts. Like, that's not okay. And what does that do to relationships in the future? So then let's turn to social media. And speaking of relationships, more time online. They suck you in, they addict you, and the more time that is spent like this, the less time is spent like this, whether that is with your family or your friends or your teachers. And so kids are losing these interpersonal skills. Not just that, we just heard from both senators about the addictive nature, right? So kids are on these devices for 5, 8 hours a day. They also have to sleep. They also have to go to school. They also sometimes have to go and do their homework, and they have to eat. So I'm not sure how they do this, but they are losing sleep. And if you think about how we use sleep deprivation, and any doctors in the room, if you think about sleep deprivation during residency, you just don't cope as well with the ups and downs of life. It's a lot harder to deal with somebody being mean to you if you haven't, well, first, if you haven't had practice, right? But also if you have not been well rested. We're hearing about a lack of ADHD drugs. This is me saying it, it is not a psychiatrist saying it. There's a lot more kids being diagnosed with ADHD. You do get a lot of those symptoms of inattention, distractibility, inability to focus when you don't have sleep and you've got a device sitting on your desk, because it has been shown that just having the device sitting there is enough to distract kids. Even if it's not buzzing, even if it's not ringing, there's I wonder what's going on in the rest of the world. We've just seen the impact, and we will continue to see the impact of misinformation and disinformation and dangerous information and the rabbit holes that these kids go down, whether that is with suicide, and we just heard about a couple of cases of that, eating disorders, seeing images of not real people who you want to look like, and therefore you should do something with a diet. What about these Tide challenges, the cinnamon challenges, and how damaging these are? But they go, whether it is TikTok or Twitter X or any of these, it is an access into your kids' lives and into your kids' minds and bedrooms that you would never otherwise allow somebody to talk with your kids about suicide and eating disorders and a pill that'll make you be able to concentrate better, but that might be laced, 60% of the time, laced with fentanyl. I talked a little bit already about brain development in young people, but I also just wanted to mention that when schools have removed cell phones in schools, they have seen better behavior. They've seen better relationships. They've seen better grades, better test achievement, and real relationships. And, you know, parents know better. We know what is happening to our kids, but we're all addicted. And so how can we possibly expect parents to be able to remove these devices from their kids when they can't remove their own eyes from their devices? I'm sorry to say that to parents, but I am one of them. And so we've got this guinea pig generation, and I think about things like, how well will that medical student be paying attention? And are they going to be the one that's operating on me? Sorry to scare you all, but I think it's something to think about as we discuss policy and as schools decide what their responsibility is in educating the kids, educating the parents, and getting the cell phones out of the schools. In the House, I'm a co-lead of COSA. You just heard about that, and the idea is just to reduce the exposure, eliminate the exposure to these very dangerous topics. But it's also a duty of care standard that does put the responsibility on the social media company. And it's also about our kids' privacy. Their data should be their own data. And so this would create an opt-in as opposed to an opt-out. So the default is that your data does not get shared. And it changes the algorithms so that they are less addictive. So not only are you not keeping kids up all night and depriving them of sleep, you're also not sending them down dangerous rabbit holes. There's a second bill I wanted to mention called the Supporting Children's Mental Health Care Access Act. It's a mouthful. This reauthorized a couple programs. One of them is infant mental health. The other one is something that funds a program we have in Washington State. I believe you had in Rhode Island too. It is in a lot of places, called the PAL line, the Physician Access Line. The idea is that as we have a shortage of mental health professionals and kids need more and more care, which we need to deal with upstream, but at this moment they need a lot more care. A pediatrician or family practitioner is now charged with taking care of more and more complex cases. And this gives that doctor the ability to call, speak with a psychiatrist immediately, get advice on how to handle a particular situation, what kind of follow-up is needed, and a warm handoff for that child. And so now you have, I mean, the visual is a psychiatrist in a room with a phone, probably several phones, answering these calls, and instead of seeing his or her own 8 patients per day, probably helping on the order of hundreds. And I think that is a model that we should enhance throughout the country. I also just wanted to mention that I'm a co-lead of something called Sammy's Law. And Sammy was another tragic story of a boy who accessed a medication that he didn't know was laced with fentanyl online. It was fentanyl, and he was poisoned and died. This is not a one-off scenario. You heard about them from Senator Blackburn. And so the idea here is that it preserves kids' privacy, right? Like we want kids, teenagers to have privacy, but it allows for third-party apps that will just flag certain phrases that might be popping up in your kids' Instagram, Facebook, TikTok, whatever, so that you know if there are certain phrases that should cause alarm. And this would insist that all the social media companies allow this to be employed. I will keep working on the legislative level to keep kids safe. I also just want to mention that we have pushed this administration, and I will push the next administration as well, to follow through with what we know and the Surgeon General's recommendations, that we reduce screen time use. And maybe, given that all the parents are also addicted, maybe the way to do it is to do it through social media and to push the ads out to people, you know, maybe all ages, but like parent and teen age, to throw out those statistics. Did you know that your child is X times more likely to commit suicide if they are on, social media for X number of hours a day, or whatever it is? Because some of this has to happen at home while we wait for a sometimes very slow legislative process. So I want you to know I will continue to be on your side and on the side of our kids. Thank you.
Congresswoman, thank you for your leadership and really your experience as a pediatrician and how much that has shaped this. What we heard just across those two senators plus Congresswoman is, I think, the real possibilities of moving forward in a bipartisan way, which turns out is not so easy in this town. And as we think about the next administration, the next Congress, finding topics that are really important to all of us, where we're able to make progress is going to be very important. I think they're going to be hard, but they're going to be very, very important to do, and this certainly feels like one of them. Okay, now we are going to move. Hope everybody, I know we kind of rushed people back. What's that? Yeah, so why don't we do this, which is, since some people did not get food, why don't we take for people, like, let's take a 5-minute break, go get some food, bring it back, and then we'll start our next part of the conversation. And what we're going to do in the next part, just so you know, is we're going to get to the states and what are states doing. Okay, so go get food for those of you who didn't.